Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss few practice questions from 8 series, which is laboratory and pathology. And when we talk about case study, if at all, most of the time they don't question 8 series thing in case study, but if they question, they'll questioning from pathology section. Okay, so we will see few question and you will get an idea. So let's begin. So let's see our first question. A 65-year-old male patient presented with abdominal pain, weight loss, and nausea. Following diagnostic imaging and endoscopic evaluation, mass was identified in the proximal jejunum, which is adenocarcinoma. The patient was scheduled for segmental resection of jejunum to remove the malignant tumor. During the surgical procedure, the tumor, along with a portion of jejunum, was excised and submitted to the surgical pathology laboratory for gross and microscopic examination to evaluate the tumor's characteristics, margins, and staging. So, here the concept regarding surgical pathology. So, you should be knowing that under surgical pathology we have various levels. Okay, the code starts from 88300, which is only a gross examination, and 88302, 4, 5, and 7, 9. Okay, so these are the level we have: 88302, 88304, 88305, 88307, and 309. So all of these levels are unique based on the procedure complexity. So what you have to do in order to get the correct answer from these levels is you first have to check what is the specimen here and what exact procedure they are performing. So here, as you can see, the adenocarcinoma is at the jejunum. Jejunum is a part of small intestine. Okay, so you might not get this word jejunum, but you should know this jejunum is a part of small intestine. Okay, so you need to go ahead and check for a small intestine where you can get to see same specimen can be listed in multiple levels. Okay, so at that time what you have to do, you have to thoroughly check what exact procedure it is. Okay, based on the procedure you need to take the code. Okay, so say for example, if you take skin as a specimen, or maybe breast as a specimen, or maybe uterus as a specimen, all of these specimen you can find it in various level. You can see skin 88 under 88302. Okay, and skin under 88302, it is for plastic repair. Okay, and same way you can find skin in under 88304 level also, but where under 88304 what it is, for skin cyst, skin tag. Okay, and under 88305 again you can find skin as a specimen, but here the procedure will be different, which says other than skin tag, other than debridement, and other than like the plastic repair thing. So you need to be very careful and you need to select the surgical pathology level accurately. And same goes to breast also. So if you say breast mastectomy simple, this can be found in level 88307. And if you say breast mastectomy complicated or maybe with removal of regional lymph node, then you have to take your code as 88309. Okay, so there is so much variation in the level. Okay, so you need to check the code and check the different specimens which are listed in that particular code and select your answer. Okay, so for this question we will see what would be the correct answer. So you can see the options here and the description. So 88304 should be eliminated because under 88304 we don't have a specimen as a small intestine. Under 88305 you can see small intestine. This is the description of 88305 code. So here small intestine, the procedure is biopsy. Okay, so this is again incorrect. And 88307, this is the thing that you can find under 88307, small intestine resection other than tumor. Okay, it says other than tumor, but in our question we do have malignant tumor. Okay, we are having the documentation for adenocarcinoma. That means it's a tumor. Okay, so this also 88307 should be eliminated. And lastly, you have 88309, which is a quite complex procedure. And the description you can see, small intestine resection for tumor. Okay, so the correct answer is 88309. Option B is correct for this particular question. So what you can do is you can just list out same repeated specimen from all the level and find out what exact different procedure they are performing. Okay, so you should be very clear. If you don't know the concept, if you know only like the specimen, you are only worried or you are only concerned about this specimen, means you may end up getting the wrong code. Okay, so you with the specimen you need to check what procedure they are performing. So let's see one more question. So second question is the physician performs the following test on our automated equipment: HDL, total serum cholesterol, triglycerides, and quantitative glucose. So HDL one test, total serum cholesterol one test, and triglycerides. So total 3 tests, and along with that they are performing quantitative glucose test. So you should be aware about the penal coding guidelines and the concept. Okay, how we will code when we have two different penals, and how we will code with the same specimen if the provider is performing any kind of repetitive test in a different penal, what we can do or which one we need to code. So there is so many guidelines in the penal coding, so you must be knowing that. So in this question, so let's see the code description and we'll decide. So here I have added the guideline also. Okay, for penal coding, the guideline is important. You can read this. If group of test overlaps or more penal, report the penal that incorporates the greater number of tests to fulfill the code definition, and report the remaining test using individual test code. Okay, so if at all if they are giving two penals, the first thing you have to check is, are there any same test are repeated in the penals? Compare between two penal and you have to check any tests are being repeated. If you find any tests are being repeated, then you cannot code the two penal code. Instead, you will code the penal which is having more number of tests, and you will code few individual test codes which are very unique. Okay, so that is the guideline we follow. So in classes I'll explain everything properly. So here you can just see this option. So you can just eliminate option A and option B because all tests are they are given with an individual code. Just compare between option C and option D. So why how to check option C and option D is 80061. It's a lipid penal code. Okay, so you can see the lipid penal code. So under lipid penal you can get to see cholesterol serum, lipoprotein which is HDL cholesterol, and triglycerides. Okay, so 3 tests, and all these 3 tests are performed, so you cannot code these individually. You can just go ahead and assign the penal code 80061, you can code it. And with that they have also performed quantitative test for glucose. So you have to check the description of 82947 and 82950. So you can check here. 82947 says glucose quantitative blood except reagent strip. So quantitative 82947 is correct. So option C is correct for this particular question. Okay, so please go back and read the penal coding guideline. If you find any difficulties in understanding, please do comment. I'll try to help. So next question, patient with a manic depressive disorder is being treated with a lithium. The physician orders a therapeutic drug test to measure the level of lithium. What is the correct CPT code? So this test is therapeutic drug assay. Okay, so when we are talking about the drug assay, we have three different tests, right? One is screening test, okay, screening or presumptive, and next one is definitive test, and last one is therapeutic test. In screening test, what the provider will do, they will just screen. Okay, they will there, here they'll do screening just to check any kind of drug is present in a patient body or not. Okay, just to see any presence of drug. But coming to definitive drug, here what they will do, it's a confirmatory test, confirmatory and quantitative. They will confirm what kind of drug it is, and also they will quantify like how much drug is there. And when it comes to therapeutic drug assay, here it is about like if patient like they'll take the serum like blood serum or a cerebrospinal fluid. Okay, they'll take the serum and they will measure how much the drug like the toxicity, maybe patient is on a current continuous medication for long and it caused some adverse effect. So for the many reason they will check the level of the drug using serum. So same thing they did here, using therapeutic drug they are measuring the level of lithium. So what you have to do, you have to go under therapeutic drug and check for the code for lithium. That's it. Okay, so there are options they have given here. So let's see the answer. So you can see the code description under 80, option A 80178, which is for lithium. Okay, so you can select your answer as option A. So you can also check this guideline. Therapeutic drug assay are performed to monitor the level of known prescribed or over the counter medication, and the material for examination is used whole blood, serum, plasma or cerebrospinal fluid. Examination is quantitative. Okay, so this is the information about therapeutic drug assay. So yes, uh, that's all for today, and I hope I am making videos continuously. So even if it is a short information or like I am taking some time and collecting few repeated question and I'm putting here. And today also someone messaged me that she has passed using my YouTube videos. So that some kind of thing, if our videos is helping someone, definitely it feels amazing. Okay, so thank you all, thank you for watching. And I have reached 12K subscribers and almost 20K subscribers on Instagram, and almost 10K subscribers on LinkedIn. So thank you for your support, and please do share with your medical coding friends and ask them to subscribe too.